You're listening to an Airwave Media Podcast.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're your hosts, Dr. Jess Steier
and Dr. Sarah Scheinman.
We are joined today by someone who was on the pod a few weeks ago, and we actually had so much fun with her and really valued her expertise and her insights that we brought her back. Dr. Nicole Lippman-Barile, who's a clinical psychologist. She's back so that we can tackle the topic of seasonal affective disorder. So I think that this episode is going to air at the end of October. We're recording it now in the middle of October. Weather's getting cool, starting to get darker a little earlier. And a lot of folks are reaching out saying that they're sad. Their seasonal affective disorder is starting to kick in. So we're gonna get into that today. Sarah and Nicole, do you experience symptoms of seasonal affective disorder, if you're willing to share?
Yeah, I absolutely do. 100%. I get hit with this pretty hard, and I have for a while, but I also suffer from depression at other times of the year as well. This is just, I find when the clocks change and the seasons change is when my symptoms sometimes will start to kick into high gear. I do know this about myself, though, so I'm able to take steps to sort of mitigate how severely I'm impacted by it.
Thank you.
I definitely notice a decline in some mood, like in the winter months, especially it feels like here in New York that winter can sometimes last for 6 months. So the longevity of that, I would say I definitely notice a specific toll and in my mood and what that takes. So yeah, there's a slight decline, but I would say I don't meet full criteria for that. So, but I'm also, very aware of that and would understand what I would need to do in order to prepare for a decline in mood in the coming months.
Well, I'm happy you mentioned criteria. We're definitely going to get into that. And I, like you, I don't meet the full criteria, but as Sarah shared, I also suffer from depression sort of throughout the year. I do notice a decline in my mood. And Nicole, as you said, excuse me, Riggins. I'm sorry, my dog just joined me. Come April, I'm in New England. So when it snows in April, I'm like, come on now. Like we're ready for flowers. We're ready.
Enough of this.
Come on. Enough of this. So can I maybe kick things off with just some stats about prevalence, how many people are affected by this? And then maybe, Nicole, you can, hold on. Before I do that, Sarah, do you want to start with the definition? I have a feeling. Yes,
always.
Okay.
You know it.
Okay, so what are we talking about?
Broadly speaking, when we're talking about seasonal affective disorder, which, by the way, abbreviates to SAD, which I love that. I love when scientists have a sense of humor. Like that's just, it tickles me. Okay, so SAD is a type of depression and it's related to the changes in the seasons typically. And it usually begins and ends around the same time every year. And so like most of the symptoms typically begin in around the fall and continue throughout the winter. And I believe it is considered, Nicole, correct me if I'm wrong, like a subtype of depression. So it's not necessarily a diagnosis in and of itself. Is that true?
Yep, exactly.
And Jess, like why don't we have a resident biostatistician dig into the actual statistics on this now?
So it's interesting. When I was looking up the stats, I'm wondering if maybe these numbers, like, is this something that could potentially be underdiagnosed? But anyway, we could maybe chat about that. But here are some statistics.
I would imagine so. I mean, I think depression in and of itself is underdiagnosed.
Very, very true. But I did pull some stats. These come from psychiatry.org. We'll link to this in show notes. So it's estimated that in the general population, SAD affects between 0.5 to 3% of the general population. When we look at the U.S. specifically, about 5% of adults are diagnosed with SAD, and it typically lasts about 40% of the year. So I thought that was very interesting. There are certain variables, demographics that impact the prevalence of SAD and also the severity of it. So we know that SAD appears to decrease in prevalence with age. It seems to affect women more commonly than men, with a ratio of 4-to-1, which I thought was really interesting. There are also differences by region. So for folks who live farther from the equator, I guess it's more pronounced in those populations. So impacted by the latitude where folks live, which highlights the role of daylight exposure in the disorder's onset. And yes, we're going to talk all about light. We got lots of questions about that. Other conditions. So SAD affects 10 to 20% of people who are diagnosed with major depressive disorder and about 25% of people with bipolar disorder. And Sarah, you did a great job of defining SAD, and definitely curious to hear what Nicole says from a clinical perspective. But psychiatry.org says that SAD is characterized by mood disturbances that typically occur in the autumn and winter, with remission in the spring or summer. Symptoms often start with fatigue and low energy and can involve sadness, lethargy, and apathy. And we are also going to talk about, I just want to set the stage for people. I guess some people have what's called reverse SAD, and they actually experience these symptoms in the summer, which I thought was really interesting. We actually had several people, we put out a question box, and several people commented that. So Nicole, you mentioned clinical criteria. Can you sort of walk us through what you look for in your patients?
Sure. So it is considered a subtype. It's considered a classifier. So if the first thing that we're sort of doing is assessing for a history or sort of presence of major depressive symptoms. And that is criteria that we would see delineated from like the major depressive disorder category. So this is, yes, persistent and sad mood for at least 2 weeks for most of the time. And then also a variety of other kind of behavioral disturbances, cognitive disturbances, and impairment in functioning to a certain extent. And with SAD, what we're doing is we're trying to figure out if there's some sort of seasonal pattern related to the onset and the duration of their symptoms. So if their symptoms are beginning at this time and they have some sort of remission or some sort of major decrease in symptoms around the springtime, and there's this sort of this pattern that tends to emerge over like a couple of years, then that would delineate that that is SAD versus something that is just strictly major depressive disorder. It's also technically considered a subtype of bipolar as well. So the other thing that we're evaluating for is criteria related to bipolar disorder. And again, we're sort of looking specifically to see if there's depressive episodes that are occurring during this seasonal time. And that's the indicator that tells us, okay, it's more than just major depressive disorder or more than just bipolar disorder. There's this SAD component that's actually occurring during these specific time points for people. And so treatment is sort of specific to this time period.
Interesting. And so just to comment on sort of the clinical recognition of this condition. So when you look at historical accounts, it's highly likely that people were experiencing these seasonal mood changes for centuries, right? And previously, people were referring to this as winter blues or low moods during colder, darker months. But it wasn't until the 20th century that these observations were actually explored systematically. And then in the 1980s is when we had this formal recognition of SAD as a clinical diagnosis. So the term seasonal affective disorder was coined by Dr. Norman Rosenthal. He was a psychiatrist and researcher at the National Institute of Mental Health. And in 1984, he and his colleagues published this groundbreaking paper detailing their research on people whose depression worsened in the winter months and improved in the summer. So anyway, I just thought it was interesting that this has likely been around for a very long time, but not formally really recognized and classified until the 80s. So Sarah, as a neurobiologist, can you sort of tell us what's going on in the brain when we're talking about seasonal affective disorder? What are some of the things that are going on biologically that are impacting our mood?
Yeah, so I think we can't talk about seasonal affective disorder without talking about circadian rhythm. And just to define what we're talking about when we say circadian rhythm, it's the body's pretty remarkable ability to know intrinsically where we are in time. So it's at first I thought that it was the body's 24-hour internal clock. But as it turns out, in the research that I did for this episode, there are even more finely tuned internal clocks than just the 24 hours. So there's a whole field, there's a whole subfield of biology called chronobiology, fascinating subfield that just studies how our body knows what time it is and where we are linearly in time. So there's parts of our brain that know what time of year it is. There are parts of our brain that know what hour it is in the day. And there are parts of our brain that know from to the second where we are in time. And that's, an example of that would be when someone throws a ball at you, you know exactly like when to put your hand up to catch it. That's also part of our circadian rhythm. So it's this whole broad network of brain regions that tell you where you are linearly in time. But with regards to seasonal affective disorder, we're talking about a specific part in our brain. It's one of the more primitive biological clocks, and it's called the suprachiasmatic nucleus, or the SCN. And it's this teeny tiny little brain region. It's 0.25 millimeters cubed. It's a tiny, tiny region. And what that part of the brain does is it regulates cycles of alertness and sleepiness based on primarily light changes to our environment. So the changes in light. And what regulates that particular biological clock is the 24-hour light-dark cycle that makes up a typical day. And the brain sends out rhythmic signals related to this cycle using chemical messengers, including hormones, such as cortisol and as well as cytokines and different neuronal signals from the peripheral nervous system that tells us where we are throughout the day. Now, in seasonal affective disorder, what happens is usually this coincides with a changing in the clock. So like daylight savings time, for example. And what happens when the clocks change and when the days get shorter is your circadian rhythm is interrupted because the 24-hour light-dark cycle drastically changes. And this can really throw your internal, your homeostasis all out of whack. So we think that this is a big contributor to SAD and seasonal affective disorder.
Okay, wait, side note, isn't there a major movement to get rid of daylight savings? Am I making this up?
I really hope so.
I think there should be.
I know there's a whole reason, and I should have looked this up, like why we do it. Is it something with...
I know we did it with regard to agriculture. So we would have an increased number of daylights in which to harvest crops. But since a lot of that is done by robots these days, I think maybe we don't need it anymore because those guys can work in the dark.
Yeah. Wow, there's an actual act, the Sunshine Protection Act, which would make daylight savings time permanent. It's stalled in Congress. The Senate passed the bill in 2022, but it didn't come up for a vote in the House. The 2024 version of the bill hasn't passed the Senate committee. But anyway, this is definitely something that folks are talking about. I mean, anytime
people care passionately about this.
They really do. But anytime we change the clocks, I feel like there is this, like everyone, as a parent, it totally throws off. Forget it. The kids are all thrown off. They're sleeping in, they're up at the crack of dawn. I mean, it really, that 1 hour really affects things. Nicole, I see you nodding. You know.
Yeah. That's why I hate it. And I hope the Sunshine Act makes its way eventually. Well,
I mean, it makes sense too, because like exposure to sunlight is a really powerful stimulus for our circadian rhythm regulation. And the reason for that is because like the SCN summates the amount of light we get in a 24-hour period. So it sort of has like this cumulative effect. So if there's less light during the waking hours that we're exposed to light, and most people spend the majority of their day inside anyway, then it's less likely that we will have that natural exposure to light.
So, Nicole, Going back to you, clinical perspective. Let's say you have patients who come to you, you diagnose, you recognize that this is something that they're dealing with. How do you advise them? What are some of the treatments, therapies, or ways to deal with SAD?
Sure. Yeah. So one well-established intervention is bright light therapy. So it's basically kind of what it sounds like. It's exposing yourself. I think the recommendation is like 30 minutes daily to 10,000 lux. That's the rate of light that has been determined to actually help over time reduce these depressive symptoms. So that literally looks like a person sitting in front of a light box, usually about like a foot or two away from their face, and just being exposed to that light for those 30 minutes of time. I used to work with someone, actually, I do home sessions, and I was working with this person for OCD treatment, but she also experienced SAD. So in the mornings, I would come over and we would do some work, but then when she was eating breakfast, she would just sit in front of her light, her light in for the day. So bright light therapy is one really good intervention. There's also, in terms of psychotherapy, we could do CBT, cognitive therapy, for SAD, because there's still likely some negative depressive cognitions and behavior that are likely reinforcing the depression. So that's something that we would want to identify and try to challenge and try to work on. So CBT is definitely one other intervention that we would do. There's also meds. So this would include basically SSRIs. So these are antidepressants, but I believe there's one medication actually more specific to SAD, and I think that's Wellbutrin. Yeah. So Wellbutrin is a medication that's known to have a little more evidence to support actually targeting, being more effective for people who experience SAD. So there's usually these like three primary interventions that we tend to go to. And sometimes there's a combination of that helps people the most, depending on, level of impairment and how severe, a person's SAD symptoms actually are. So those are the treatments that we have.
Yeah, I'm on Wellbutrin, big fan. I also have a light box. I usually don't bust it out until daylight savings time happens, but I start every morning by I wake up and I make my coffee and I read a little bit in the mornings. And so I sit in front of the SAD light and I read. What's important about the SAD light is you're not supposed to actually look directly into it because it's 10,000 lux of light. So it's a very bright light. Just to give you guys an idea, typical sunlight is 100,000 lux. Lux is just a unit of measurement to define like the brightness of light. So outside on a sunny day, it's 100,000 lux of light that you're exposed to, and indoors, just under your day-to-day lights, that's about 1,000 lux. So 10,000 lux is what's recommended that you get from the artificial light source.
Wow. And did you keep it on the whole day, or do you only? No. Okay. So just short periods of time.
Well, and primarily, Nicole, correct me if I'm wrong, you're supposed to do this in the morning, the earlier part of the day, because again, exposure to that type of bright light later in the day can also mess with your circadian rhythm. It can cause sleep disruptions.
Interesting. Yep. Okay. Well, okay. So we got a ton of questions about light therapy. And I wanted to share when I was researching for this episode, I guess the therapy, it was interesting. So we mentioned that SAD really was recognized in the 80s. And by the way, I failed to mention that in 1987, it was included as a specifier in the DSM, which allowed it to be diagnosed as a seasonal pattern of major depressive disorder. And then later editions of the DSM continued to recognize SAD, which really reinforced its legitimacy as a clinical diagnosis. And of course, that continues today. But also in the 1980s is when this development of light therapy really became popularized. And there has been a ton of research, and researchers have found consistently that exposing patients to this bright artificial light for a period of time each day can significantly alleviate symptoms. And again, this is all based on the theory, which Sarah, you already walked us through, that shorter daylight hours in the winter contribute to this disruption in circadian rhythms and a reduction in serotonin production. I would imagine, Nicole, that this is, I don't know, that there's like a spectrum of SAD, and some folks have more significant symptoms that may be, different levels of impact on their day, right? And so it might be that maybe this light therapy, I mean, as with all things, right, works for some, but not for others. Maybe there needs to be a combination. You mentioned some other potential treatments, Wellbutrin, all these other things. So it might be a combination of factors that works for folks. Sarah, is there anything else that you wanted to talk about before we turn to our Heard from the Herd segment? Because we got a bunch of really good questions.
Yeah, let's go there.
Heard from the Herd.
All right. So kicking off our Heard from the Herd segment, for folks who don't know, we open up a question box before we record episodes, allowing you to submit your questions. This happens on Instagram. So definitely follow us on Instagram if you don't already at Unbiased SciPod. But all right. So here are the questions. I think we're all kind of touching on this, but a lot of people were saying, are there any tips on combating fatigue when it gets dark earlier? The second it hits 6 p.m., it feels like 9 p.m. I start feeling very sleepy and I'm no longer productive. So I know we already talked about some things, but anything else to add? Any tips or advice? Nicole, perhaps?
Yeah, I have a couple of thoughts related to that. So one thought is, this is actually coming from some interesting studies related to sleep and how we actually then appraise our feelings of tiredness and fatigue the next day after we think we get a poor night of sleep. Not to say that this is connection, but if there's a sense of fatigue and this sense of tiredness, one thing to actually think about is to maybe schedule some kind of pleasant activity around that time, because we also know that increasing mood, generally speaking, can try to help combat some sense of fatigue, especially if there's some negative thoughts around feeling fatigue and, oh no, here I am, I'm feeling really fatigued, I'm not going to be able to accomplish X, Y, and Z. So there's something to, I think, scheduling some kind of pleasurable activity around that time so that you can increase your mood and get it and get that. I think another potential intervention, if you can do it, is engaging in regular exercise, just because we know that that is also something that tends to help with feelings of fatigue. And also that tends to be a mood booster as well, so that you can kind of get a double whammy from that sort of intervention. So I think something like that, or some kind of combination of those things, is something to think about around that time, because your thoughts also have a lot to do with our perception of, let's say, fatigue, tiredness, sometimes our feelings of sadness. So sort of checking in like a little more objectively, that's coming from like a more of a CBT kind of a standpoint, that might be effective for some people.
Yeah. And from a biological standpoint, a lot of what you said makes sense from when we're thinking about those internal biological clocks. I mentioned that one of the main regulators of those is light, but there are also other regulators and cues from external factors that we can use to sort of like trick our body into thinking that we're getting a more regular, regimented 24-hour light cycle, even when the nights are longer and the days are shorter. And these include like food, eating at regular intervals, and getting exercise that again at those regular intervals. And we can, using these other cues, and in addition to bright light therapy, like can sort of trick our bodies and these internal clocks into thinking that everything's copacetic, when in fact we have 2 hours of daylight a day.
Mm-hmm. I also this all is great. I'm just trying to think about what I do, and I'm not a neurobiologist nor am I a psychologist. But I try to lean into some of the, what are fun things that we could do when it's dark? Like we'll start we have a little fireplace. We'll start a fire. We'll make s'mores. Obviously, Sarah's coming over, by the way, in 2 days. Sarah, we making s'mores? You got real excited when I said s'mores. All right, we're making s'mores. Mm-hmm. So again, trying to find the positive in the darkness, and obviously that can be challenging when the winter drags on, as it does for many of us living in the Northeast.
So one thing to also add here, because Sarah, you said something important in the beginning, which is, now that you know that this is what you experience, you can take preventative measures, right, in order to address it. So if you know you're someone who does likely experience these kinds of symptoms, starting now or even 2 weeks ago, really, I would really start using some of these interventions, because you may anticipate some of the fatigue to increase, but if we can start catching it a little bit early and trying to do something, establish some kind of habitual pattern of regular exercise, regular eating, like all the things we're kind of talking about, it tends to set up a person so that they're more prepared and hopefully experience actually less symptoms. So that's another thing to keep in mind for people.
Okay. So the next question, well, we got a million questions about light therapy, but I think we've touched on it. I did want to mention that there was one question about different colors of lights. So I guess someone mentioned distinguishing between blue and green light therapy. I don't have you all heard about this? Any thoughts? Anything to comment on there? Or is this is kind of new for all of us?
I mean, I do know that different wavelengths of light emit different colors. Like, that's a thing. But I think with regards to bright light therapy and the effect that it has in regulating our circadian rhythms and therefore combating symptoms of SAD and other mood disorders, I believe that it depends. It's really more dependent on the lux, so the brightness of the light, as opposed to the actual wavelength. I've not heard that any kind of wavelength of light is more effective at regulating circadian rhythms than any other wavelength of light.
Mm-hmm.
I mean,
same here.
I just did a very cursory search. I'm not going to lie, I did not deep dive on this, but I'm not seeing a ton of research on this, which leads me to believe that perhaps there have been a couple of maybe small studies that have differentiated, but I'm not seeing any robust evidence that there is a particular wavelength or color that is more beneficial. I will say it looks like, and again, please take this with a grain of salt, because I would bet that this is, we're talking about a couple of small studies here, but people are saying blue light therapy is considered more effective than green light therapy for treating SAD. Let's see. I know. Again, grain of salt. Let's see here. Light with these are the claims. We are not co-signing this. Light with short to medium
Show me the data.
Light with short to medium wavelengths, so blue, green, and yellow, is essential for light therapy to be effective. Yeah. Again. Not seeing a ton of. Oh wait, and others are saying blue light is absorbed by, what is this, melanopsin? Is that a thing? But blue light is also most toxic to the retina. Green light affects melaplasmin strongly. Okay, basically this is feeling like there's not a whole lot of solid evidence saying one way or another, and Sarah just looks bewildered. Sarah looks bewildered.
I am bewildered, as I often am when when I'm confronted by claims on social media.
Right.
Oh God.
So
yeah, it's
we're not convinced. Does not seem like there's a whole lot of robust evidence. Okay. And just to be clear, Sarah, the light box that you use, it's just a white light? Okay.
Correct.
Got it.
Yes. And it is a very bright white light.
Got it.
Because if we're sort of tricking regions of the brain into thinking that we're being exposed to actual sunlight or daylight, again, we're talking orders of magnitude higher than the brightness that we experience from indoor lighting. Like 100,000 lux is what you get from the sun. So we're talking like 10,000 lux from this artificial light source. It can do something. It's really not the same as getting the light from the sun. But I mean, when the light from the sun is, it's white light. It's not
right.
Any kind of color that is better.
Oh, Sarah. So, okay, this next question came up quite a bit. I guess that there are a lot of supplements being marketed to folks for SAD, in particular vitamin D. So can we spend a little bit of time talking about vitamin D? Nicole, I don't know if you've seen this claim. Are you convinced of vitamin D supplementation helping with SAD?
I am not convinced. I am not convinced at all. I think there's a lot of mixed evidence in terms of the actual studies that we have. A lot of the methodologies are poorly designed, and also there's different dosages of vitamin D. There's different ways things are measured. There's a lot of ways I don't think we can really accurately interpret the studies, and I don't think there's any solid evidence to make that kind of level of support that someone should be actually taking vitamin D as a supplement in order to treat these symptoms. We don't have any sort of conclusive evidence to suggest that.
Well, and my initial thought is that we're kind of messing with, we're in correlation territory here, right? Because we get vitamin D, the sunlight is a source of vitamin D, right? And so if we're talking about times of the year where we're exposed to, less sunlight, it makes sense that we would have lower levels of vitamin D. Now, is that what's causing SAD? And would supplementation with vitamin D then cure or impact SAD? Yeah. It feels like a leap. Okay, Sarah is saying no.
No, it wouldn't.
Okay.
It wouldn't because I probably where this came from, right, is because you can get vitamin D from sunlight, right. But it's not the vitamin D, it's the light itself that is so beneficial to regulating our chronological states. And it's, so if you remove the light part and just are taking drops of vitamin D or pills of vitamin D, you're negating the actual beneficial components.
Mm-hmm. Right.
Yes.
Also, Nicole, I know we're both friends and colleagues with Dr. David Robert Grimes, and he has this whole thing. I mean, you got to go to his page and check it out, folks, about how I guess he feels very strongly and points to a lot of evidence that points to the fact that we are really overestimating vitamin D deficiencies, because there are a lot of folks, particularly in the wellness space, who say, we're all walking around with vitamin D deficiencies and we all need to supplement. But Sarah.
Didn't know that.
Just drop some social media on Sarah.
No, you guys should have a segment like Surprise Sarah, and then you just claim, and then Sarah, you just give your very honest reaction.
Here's one. We're all vitamin D deficient.
Yeah.
That's a lot of people that aren't getting enough vitamins.
Right.
We should all be experiencing very severe problems here.
Right.
All of us should be very ill.
And of course, there are likely, there is a segment of the population that is deficient, but it seems like maybe social media is making us think that that's more common than in reality. We always like to give the disclaimer that, remember, that supplements are largely unregulated. And, there can be drug interactions. So vitamin D, oh my God. Do you see this dog right now? I'm so sorry. If you're watching on YouTube, this is pure chaos. I have all 4 dogs here, but Riggins is on my lap, putting his stinky hot breath in my face. So vitamin D can interact with some medications. I think people just assume, these are supplements, they're vitamins, they're, or if they're herbal, they're safe. That's not necessarily the case. We say this ad nauseum. This is definitely the millionth time you've heard this on this podcast. But yeah, so is the consensus here among the consensus is that vitamin D, there's some correlation that's being confused with causation here. The focus and more proven therapeutic would be light therapy versus vitamin D supplementation. Is that yes?
Yes. Cosigned.
Yes.
Okay. You heard it here first, folks. Yeah. Stamp of approval. And then just to get ahead of it, we will get comments from people who say that vitamin D has helped them. We hear that all the time. That while anecdotal, great that it seems to work for you. But again, this is something you should definitely talk to your healthcare provider about because of these potential interactions and all that good stuff. So anyhow, all right, Sarah and Nicole, is there anything that we haven't talked about that you think is worth mentioning in the context of SAD, or any final thoughts before we start winding down a bit? We covered a lot of ground here.
We did cover a lot of ground.
So if I can reinforce the legitimacy of it, because I know that sometimes mental health disorders in general still have very much a stigma associated where, we could sort of exercise or diet our way out of a disorder. And I just want to legitimize the fact that for people who do experience SAD, that it's very real. It very much impacts people on a daily level of functioning. It very much can last several months, not just the exact sort of diurnal pattern and seasonal patterns that we have. So I just want to legitimize that for people. And if you need the combination of treatments, sometimes it is that holy grail of actually doing therapy, doing meds, and doing Lightbox, sometimes we do need a variety of different kinds of interventions, and that's okay. That doesn't mean that you're not doing anything right, but anything wrong. It means that you're actually doing something right and trying to actually, improve the quality of your life. So I always want to reinforce that for people, that this is legitimate. And if you suspect anything, to really seek out a licensed mental health professional to get evaluated.
Yeah. And along the same lines of lending legitimacy to it, I mean, there have been certain genes linked to increased susceptibility to SAD. And these genes are largely related to serotonergic transmission. So neurotransmission of the neurotransmitter serotonin, which we touched on briefly, which is thought to be maybe dysregulated in depression in general. So there are genes linked to serotonergic transmission that have been implicated in increased susceptibility to developing SAD. There's also one gene there was what's called a genome-wide association study that was conducted a couple of years ago on seasonal affective disorder, and the candidate gene that was set above the rest is a gene called ZBTB20. And it's a gene that has been known to regulate circadian rhythm in mice. So we do know that this is a real thing, and it can be kind of a bummer, but there are things we can do to treat it.
There is one thing actually that we didn't talk about, and I'm so sorry to those who submitted questions about this: reverse SAD. So just very briefly, I wanted to mention that this is a type of depression that occurs in the summer months. It affects about 1% of Americans. The symptoms of summer SAD include poor appetite, weight loss, insomnia, agitation, anxiety, and increased irritability. And whereas winter SAD is associated with shorter days and colder weather, summer SAD is associated with longer days, heat, and humidity. And interestingly, light plays a role in both types of SAD, as too much light can also disrupt the body's circadian clock and lead to insomnia. So I wonder whether there's some link there with, sleep or something like that. And let's see, I guess it's thought that up to 10% of people with SAD get it in reverse, and that there are some studies that have shown that in countries near the equator, such as India, summer SAD is actually more common than winter SAD. So I don't know exactly what I don't know. I mean, this is definitely, it seems like a less on the radar thing, but it is a very valid issue for many people. Yeah.
I think it all goes back to I think 9 times out of 10, when you ask a question about science, it all comes down to homeostasis, right? And with regards to homeostatic regulation of the chemicals in the brain, so melatonin production is associated with sleeping, and that's linked to a region of the brain called the pineal gland. And serotonin production is more associated with like alertness and wakefulness. So this balance between melatonin and serotonin is definitely linked to regions of the brain that process light. And so I have no trouble believing that that regulation in either direction of the amount of daylight that one is typically used to with regards to our 24-hour cycle can lead to disruptions in mood.
Well, and Sarah, I definitely don't want to put you on the spot here, and perhaps we'll do a whole episode on this, but we get tons of questions about melatonin supplements, actually, for both adults and for kids. I know I just was reading something about how they did tests on a bunch of different melatonin supplements, and the levels were actually far higher than was being, reported on the labels. Anyway, there's lots of issues. We'll talk about that in an entirely different episode. But I didn't want folks thinking that you're sort of implying that we should, for those who are impacted by this, that they should necessarily run out and get melatonin supplements.
No. But all I was saying is melatonin. Please don't do that. No, melatonin is a sleep hormone. We produce it in our bodies naturally. Don't go buy anything.
Oh my gosh. Nicole, any thoughts on that, or any final thoughts?
I love that. We have to, you have to say, like, please don't do that. Please no.
Right.
Please say no.
Just say no.
And it's
totally agreed. Just
Well, this is such a common theme. Like, there will be seeds of truth, right? Like, there is something going on with melatonin. There might be something happening with vitamin D, but that doesn't mean that then, that we have to supplement with those things and that they would have a clinically significant impact on these outcomes. It just, that's a very common theme, not just specific to SAD, right? Lots of different things that we talk about. But sorry, Nicole, you were going to say something.
No, that's so true. That's so true. It's an simplification of like biological processes and like other things are interacting with that. So, but yeah, I was going to mention just from like a sort of an assessment evaluation standpoint is, usually people who are more susceptible to experiencing SAD are those individuals who do have a history of major depressive disorder and bipolar disorder. So if that's within your history, but maybe you're sort of discovering there may be this other new pattern emerging, that there's a seasonal pattern to some symptoms, because over time, symptoms can change and sort of morph, and that could look like different time periods. That could look like different presentations, in terms of how depression can manifest. So, but if you have a history, you are more likely and susceptible to experiencing SAD. So that's just another thing, as in terms of from the assessment standpoint, that as a clinician, I would keep in mind, but also for a person experiencing symptoms, that's something to also think about, because it's more likely you may actually have it.
Well, thank you to Dr. Nicole Lippman-Barile, our favorite pizza bagel clinical psychologist. You can follow her at Feed Your Mental on Instagram. And just remind me, Nicole, are you on other platforms, or is Instagram your primary? Do you need more?
Technically, and I just don't. So Instagram, yeah.
Got it. Okay. And we'll link to this in our show notes, of course. And a reminder to folks, if you don't already, follow us on social media at Unbiased iPod. And we also have a newsletter, which we're saying it's once weekly, but really we've been pushing like 2 or 3 articles out a week because we got a lot to say. You can sign up for that at theunbiasedipod.substack.com, and we will link to that in our show notes as well. Sarah, please take us home.
All right. Thanks for tuning in, everyone. We hope you learned a thing or two. I certainly did. Join us next week on your trusted source for no nonsense, just science.